Okay. So what we introduced here is an open roof. We have to close the open roof and we have to narrow and to realign because there's a little deviation to the right of the bony pyramid. Therefore we have to do micro osteotomies. But before we do this, we have to be sure that there are no irregularities. So we have to check this. Maybe I have some water. It's best to leave this to your assistant.
Thank you.
So, Rutger, you try it out. Still a little bit of irregularity at the bony part. I agree with that. So, the bony irregularity we can get rid of with a rasp. So, I like to have the tungsten carbide rasp, as you can see here. It's a very strong material, stays sharp for a long time. Okay. The other bony part, the other side. Okay. Feels better. So now we have to do micro osteotomies. We start with the medial oblique. We first sharpen the osteotome. Okay. So now I'll introduce the 3mm osteotome, and we go as high as possible in the open roof to find the site to make the osteotomy. So we can start here. Nee. We moeten hem juist hebben. Yes. Okay, quiet. Yeah. Strong bone. You hear a different sound, then it goes well. Now we go to the other side. As high as possible. Yes, very quiet. Start very quiet until you're in the right side, right direction. Yes. Wait. Yes. Okay. Next step is that we do the lateral osteotomies. We can choose or a percutaneous, transcutaneous, just through the skin, make little point osteotomies along the marked line of your lateral osteotomy. The other possibility is that you do endonasally, just bring the osteotome on the piriform aperture at the site of the attachment of the inferior terminate and go along. It's less traumatic, but less easy to handle. So I show you at the left side the percutaneous osteotomy. So we make first an incision, halfway the pathway, as you can see here. Be aware of the angular artery. It can be annoying, the bleeding. So what I often do is to bring my osteotome a little bit up, scrape it down, and then start my little point osteotomies. Okay, that's one. Go downward. leave a little triangle of bone at the piriform aperture. Okay. Very strong bone. Okay. Then we check if that's enough. Try to do some infraction. Then we see there is some infraction. Okay. It's important that we are sure that the bones are very well mobilized, because otherwise there is a chance that post-operative it goes back lateral, in a lateral direction. That's not what we want. Okay, it's quite good mobilized. Now we perform at the right side our osteotomy, lateral osteotomy endonasally, just on the piriform aperture at the site of the attachment of the inferior turbinate. We try to find the right position, just first downward to leave a little triangle. Yes, tip tip. Okay, then we take over in another direction. Yes, 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 yes. Yes, go on. Strong bone. Quiet. Yeah. Tap tap. Okay. Okay, infraction. Perfect. So there's a good alignment, realignment of the bony dorsum. We have a nice profile with nice supratip tip. There's some refinement of the tip, and now we close the intercartilaginous incisions. It's important just to close the intercartilaginous incisions at the point of the transfixion and intercartilaginous incision. Now we close the intercartilaginous incision at the left side.